Hello and welcome to another telehealth information video. My name is Garvin and today's video is on Inovelon. Inovelon contains the active ingredient rufinamide, which is known as an anticonvulsant. Inovelon is used to treat epilepsy. Inovelon comes in tablets and oral suspension. The tablets and liquid are taken on a regular basis to help prevent epileptic fits. So how does Inovelon work? In people with epilepsy, there is excessive electrical activity in the brain. This leads to unusually rapid and repetitive electrical signals to be released in the brain, causing fits and seizures. Rufinamide, the active ingredient in Inovelon, works by stabilizing electrical activity in the brain and calming overexcited nerves. It is thought that rufinamide achieves this by affecting sodium channels in the brain, as sodium is needed to build up in the brain cell for it to fire an electrical signal. Rufinamide affects the amount of sodium in the brain cell can store, decreasing hyperactivity of the brain cells. The prescribed dose of Inovelon will vary from person to person. It is important to follow the instructions given to you by your doctor. These will be printed on the dispensing label that your pharmacist has put on the packet of medicine. If you're unsure about anything, ask your doctor or pharmacist for advice. Inovelon is usually taken in 2 separate doses daily, one in the morning and one at night. Both the tablets and suspension should be taken with food. If you forget to take a dose, take it as soon as you remember, unless it is time for your next dose. In this case, leave out the forgotten dose and take your next dose as usual when it is due. Do not take a double dose to make up for an earlier missed dose. It is important that you don't alter your dose or suddenly stop taking Inovelon without talking to your doctor first, especially if you have epilepsy, because missing doses can trigger seizures in some people. Inovelon may cause drowsiness in some people, affecting your ability to carry out certain tasks. It is recommended to abstain from driving and operating heavy machinery until you know how this medicine affects you. Rufinamide may make hormonal contraceptives less effective, increase your chances of falling pregnant. It's best that you insure yourself with an additional form of non-hormonal contraception, such as a condom, to prevent pregnancy while taking Inovelon. It is very important to women with epilepsy to talk to the doctor responsible for their epilepsy treatment before becoming pregnant. Anti-epileptic medicines should only be used by pregnant women if the expected benefit to the mother outweighs the risk to the fetus. Inovelon should not be used during the nursing period. Breastfeeding women are advised to bottle feed their babies, as Inovelon may pass into breast milk and affect the baby. Alcohol consumption should be kept to a minimum when taking Inovelon, as it may worsen some of Inovelon's side effects, such as drowsiness. Make sure to tell your doctor what other medicines you're taking, including herbal remedies, as they may interact with Inovelon, especially psychiatric medicines such as antidepressants and benzodiazepines. Some common side effects of Inovelon include muscle twitches, blurred vision, diarrhea, and indigestion. This is not a complete list of the possible side effects. For more on the side effects, you can go to my website, lynchespharmacy.com. If you experience a worsening of your epilepsy, an extreme dip in mood, or suicidal thoughts, it is important that you consult your doctor immediately. Remember, all medicines have potential side effects, but this doesn't mean that you'll experience them. So that brings this video to an end. If you have any questions, make sure to leave them in the comments below or contact me through lynchespharmacy.com. Thank you for watching. Stay healthy and stay informed.